Is schizophrenia now under neuro's purview, or is it immunology?
Or is it under infectious disease? There have been multiple cases like this, but here is just one. This teen boy was diagnosed with schizophrenia, which really is unusual because typically people who have schizophrenia are not diagnosed until their 20s. Honestly, like a big part of the problem with the diagnosis of a teenager is that, this isn't a joke, it can be difficult to determine that certain behaviors attributed to schizophrenia also can be attributed to adolescence, because adolescence can manifest with a lot of erratic and irrational behavior. So usually diagnosis is delayed until a person's 20s. But this teen boy was diagnosed with schizophrenia. Then a doctor noticed that he had what looked like stretch marks that commonly women who are pregnant get, or people who gain weight rapidly may get. But there are rashes or lesions attributed to this infectious disease called Bartonella hynsulae. Now, Bartonella is also known as cat scratch disease because people can get it from the scratch of a cat. And these rashes or these lesions on the skin can actually look like a cat scratch or like stretch marks. But the infection can also come from fleas, and people with Lyme disease sometimes have Bartonella hynsulae infection, which suggests that the infection also can come from ticks, but that is somewhat controversial. In any case, this teen boy was diagnosed with schizophrenia. Then a doctor noticed that he had these telltale rashes, and he tested him and diagnosed him with Bartonella. He treated the Bartonella with what was called in the case history. A case history is a report written about a medical case that's published in a medical journal. So this teen boy was treated with what was called antimicrobial chemotherapy. What that meant was a mix of antibiotics, antifungals, antivirals to treat this Bartonella. The Bartonella was successfully treated and cured, and guess what? His schizophrenia was cured. His schizophrenia was not schizophrenia in the sense that it's treated in psychiatry. It was schizophrenia as a symptom of an active infectious disease. This, like I said, is not the only case of this happening, and so scientists at the University of North Carolina decided to study this, and they have found evidence of Bartonella infection in people who have schizophrenia. So it is now known that Bartonella can cause several diseases in animals and human beings. And the University of North Carolina at Chapel Hill has found evidence that Bartonella infection in the blood of people with schizophrenia and schizoaffective disorder. So the person I stitched to was talking about neuroscience or neurology, medical practice. And he was saying, that's an interesting question. Why is schizophrenia not considered a psychiatric issue? Why isn't it treated by neurologists instead of psychiatrists? This is very personal to me because throughout my 30s, I was really sick, and I was getting sicker and sicker and sicker with primarily severe neurological problems, but I was also having cognitive problems. Like basically, I had something like early onset dementia in my early to mid 30s. I really did, and people thought that I was just stressed all the time, and they generally did not believe me. I also had some perceptive problems. I didn't have like full-on psychosis ever. I didn't hallucinate, but I had moments when I was way overstimulated and I kind of became afraid of people. Like, my reaction to groups of people was absolute panic, and I had no rational explanation for this. When I was diagnosed with Lyme disease and Bartonella infection, both of those things, I was treated with several different antibiotics over an extended period of time, and all of my neurological problems went away for good. But guess what? So did my anxiety and panic disorder. I do not have social anxiety of the type that I had before, and I don't have any kind of panic disorder like I used to have. And I had this for almost the entire decade of my 30s and some of my mid to late 20s. So for me, as I understand it, this is very cut and dry. I had infectious disease in my central nervous system, and it affected my brain. No surprise, right? But who was I treated by? Well, neurologists could not figure out what was wrong with me. The first neurologist I went to gave me a bunch of tests. At first, he thought I probably had multiple sclerosis. He ruled that out. He ruled out ALS, and he told me I should take a, quote, nice long beach vacation, and if all of your problems don't go away, I would be very surprised, unquote. And he said, if they don't go away, I suggest you find a good counselor. They didn't go away. I did go to a psychiatrist, and my psychiatrist put me on a whole bunch of medications to sort of dull my psychiatric symptoms while she was trying to figure out what was going on with me. I went to a second neurologist a year later because my neurological problems got so much worse. And he told me, your problems are not in your head in the sense that they're imagined. Something is wrong with you neurologically. He gave me every test he could think of, and he could not diagnose anything specific, but he said, something is wrong with you neurologically. I just don't have a way to put together the evidence into a diagnosis. I can't label it, but something is wrong with you. So we'll keep checking you year after year. It's possible you may have multiple sclerosis or something like it, and it's just too early to diagnose it. So here's where we say, by the way, as the person I stitched to said, is schizophrenia then an immunological issue? People who have multiple sclerosis often have psychiatric problems as a symptom of multiple sclerosis. Multiple sclerosis is considered an autoimmune disease. People with other autoimmune diseases, like, for example, lupus, also have psychiatric symptoms of their physical illness. But guess what? So do people who have some infectious diseases. So, number one, Lyme disease. Number two, Bartonella. Oftentimes, patients will go to a doctor, the labs don't show what is wrong with the person, and they get referred to a psychiatrist, and the psychiatrist treats their psychiatric symptoms, but not the underlying cause, which may be an infectious disease. Why? Because medical practice is split up into specialties that don't relate to one another. They don't think about one another. They don't communicate with one another. And so in those cases, if someone has an infectious disease, they get farmed off to a psychiatrist who might treat some of the symptoms, but that infection persists and gets worse and worse and worse over time. It's very strange to me that people have a hard time understanding that Lyme disease, Bartonella, for example, can cause these types of psychiatric symptoms because it's very well known, for example, that syphilis causes severe, profound mental illness that can look just like schizophrenia in some patients. Not only that, but other really severe infectious diseases like HIV. When it turns into AIDS, people often, their brain is affected and infected, and they can present with severe psychiatric problems. Those include cognitive problems, those include behavioral problems, and emotional problems. We need to get different medical specialties together communicating so that they can treat underlying causes and not only symptoms. About a connection between various illnesses, which can include immunological illnesses, autoimmune diseases, and also infectious diseases, and mental health. The reality is sometimes mental illness is a symptom of a physical illness, but it's almost never addressed that way. It's very rarely even considered that may be the case. So there's a phenomenon that a lot of people are aware of that has affected women for a very long time, in particular, also affected me when I had Lyme disease, in which doctors will see a patient who obviously, who goes to them and reports that they're having serious physical health problems. The doctor will run a bunch of tests and then conclude there's nothing physically wrong with you, but something may be wrong up here. You should go get psychological help. And then what will happen is that patient will have some psychological problems, which may be mood imbalances, which may be emotional instability, which may be perceptive disorders, which could mean something like psychosis. And generally speaking, that mental health worker will then recommend medication, which will treat those psychiatric or psychological symptoms, but sometimes there's a physical health problem causing those psychiatric symptoms. And by treating only those psychiatric symptoms to tamp them down, that can allow the physiological disease process to continue and worsen over time. It might be overlooked because those psychological symptoms will be viewed as the only health problem. And oftentimes, those psychological symptoms will be blamed for causing the perceived physiological symptoms. But in fact, sometimes there's a physical disease process causing both the physical symptoms, go figure, and the psychological symptoms. And in some cases, for example, if it's an infectious disease, treating, diagnosing, and curing that infection can cure all of the psychological problems as well as the physical problems. I talked about an infection called Bartonella hynsulae, which can cause such severe psychological symptoms that it can be misdiagnosed as schizophrenia, even though there are physical neurological problems that usually accompany it. So that's the background for this comment. Emma Holmes says, "This is so interesting. I really hope these medical fields, start working together more so we can get better treatment for these issues." Well, yeah, in my opinion, I'm not a medical doctor, I'm not a nurse, I'm not a clinician of any type. I am a person who worked as a health writer, medical writer for a long time. And I worked on grants from NIH for about 10 years. So I became pretty fluent in reading medical literature and scientific studies. But anyway, not an expert, so to speak. However, I have some lived experience because when I had Lyme disease and Bartonella infections that went undiagnosed for many years, I concurrently had some psychological problems, and these were resolved entirely when I was treated with antibiotics. So to Emma's point, I agree. So the thing is, we have general practitioners, family doctors usually, who a person will go to and they'll say, "I'm having pain." And the doctor will say, "What type of pain?" And they'll go through their little mental flow chart and say, "Oh, this is nerve pain. This person should be referred to a neurologist." And a neurologist will look for certain things, but they will not factor in most of the time that psychological symptoms might be symptoms of an underlying disease. There may be, for example, an immunological disorder that's causing neurological and psychological problems, but the neurologist will only be looking for certain problems with a neurological basis. For example, multiple sclerosis or Parkinson's disease, something like that. So because a person, this is the point, because a patient is sent to a specific specialist, that specialist is going to have blinders on and only investigate for the things that they treat, that they diagnose and treat, and they may overlook a lot of other things. If that patient is not helped, they go back to their doctor and say, that neurologist didn't help me. And then that doctor will say, maybe the problem is an autoimmune disease. So they'll send a person to like a rheumatologist or an immunologist, and then they may do an investigation. This could happen over and over a period of years, and this is not uncommon. Oftentimes, they will not consider an infectious disease. And the thing about infectious diseases is many of them, not all of them, can be easily diagnosed with a blood test, but a hell of a lot of them can. And so in theory, a doctor could order so many blood tests to rule out so many different infectious diseases, but they often will not do that. They don't think in those terms, and they tend to be conservative with what tests and how many tests they will order at any given time. This has to do oftentimes with insurance coverage, but it also has to do with the way that doctors are taught and conditioned to diagnose things. And then it must be said that Lyme disease blood tests, for example, are wrong as often as they are right. There are some false positives, and also about 50% of patients who are infected with Lyme disease will get a negative Lyme disease blood test. So it's a really ineffective way of diagnosing the disease. So anyway, lots of complications. There's the central doctor who does the referrals to specialists, and the specialists only look in their area. So there's lots of other areas in between, and there may be symptoms of X disease that may appear to be neurological in basis, or may appear to be psychological in basis, or may appear to be immunological in basis, and in theory, for example, could be an infectious disease that's overlooked. Where is the medical specialty of doctors who do detective work for complex patients and say, wait, they've gone to this kind of specialist, this one, they've had these tests, but they haven't seen these specialists, they haven't had these tests, let's do those tests and find out if it might fall into a different specialty. To my knowledge, there really aren't any doctors who do that. There are people who call themselves Lyme disease specialists who sort of function in that way. There are also people who call themselves functional medicine practitioners who kind of function in this way. In some cases they do, in some cases they may not do that as well. It's kind of, I think, like a burgeoning field that isn't extremely well established. But in my opinion, we need a medical specialty that is basically the detective who fills in the gaps, because the other specialties can overlook certain things, and because it's so fragmented, the system itself, the healthcare system, is set up to overlook certain illnesses that may have symptoms that fall into various specialties but don't add up to anything within any given specialty. So if I were able to influence the healthcare field, I would say it's a priority to develop this kind of medical specialty. But, I don't have any say. I have no influence. Nobody would take me seriously. I'm not a medical doctor. I don't have an MD or a PhD, so no one would ever listen to me. I do think potentially this could be a role for artificial intelligence. AI programs very certainly could do this kind of diagnostic investigation and say, wait, These people have had all of these tests by all of these different specialties, but sometimes these diseases may have symptoms of this and this and this and this and this, but might be overlooked by all of these because the basis is not any one of these. So I feel like AI, if some really smart programmer can create an AI system to think in these terms, then that could help a lot of patients theoretically. For now, way too many patients get lost in this shuffle though.